Dear friends, my name is Ramakrishnan Parameswaran. This is my study on brain-computer interface-based study of empathic listening assessment in psychiatry. We all have been hearing about bio-psycho-socio-spiritual model of care, but we don't have an evidence-based understanding of spirituality yet. To start studying about spirituality, I am focusing on empathic listening approach to psychiatric assessment as given in the current psychiatric textbooks. Nowhere in psychiatric textbooks there is an illustration, or nowhere in psychiatric training there is a psychiatric residency program, there is a training on empathic listening process. However, in clinical chaplaincy discipline, clinical chaplaincy training programs, the entire focus is on empathic listening assessment. Once I hypothesized that empathic listening is a meditative process, I immediately knew that I can use this device, portable EEG-based device, to verify whether I would go into a meditative state when I am talking with my patients, and also whether the patient would go into a meditative state as they provide an empathic listening assessment process. So what I did was I wore this and walked into my patients' rooms and I conducted my therapy sessions or clinical psychiatric assessment sessions. So here are the 5 carefully selected case studies. In all these, number 1, 2, 3, 4, and 5, in all these case studies, I have been able to show how an empathic listening process goes through these clearly definable periods where we have got focused attentive state of meditation marked by alpha predominant wave, and then mindful state of meditation marked by theta predominance, and the transcendental state of mind marked by gamma predominance. And when the patient and chaplain, or a physician and a patient, they listen to each other in empathic state, then at some point or at several points in their interaction, they go into those transcendental, or which is, I call it transcendental, but they go through these gamma predominant states of mind where their brain becomes synchronized. In those gamma predominant, deeply empathic state, synchronized state, is their healing outcome. And this entire process can be thematically built into a framework which I call as MT framework, mindfulness to transcendence framework. And now I would highlight the 5th case study where I reversed my role with another person, another individual who was not trained in the clinical chaplaincy process. And here you would see how he would not be able to hold the empathic listening presence. He would lose the deep meditative states that otherwise he would have held, and that would have led to a good healing outcome. Advantages of the empathic listening process. Number 1, with our deeply empathic understanding of the patient's pain and suffering, our diagnostic accuracy improves. 2, even though deeply empathetically connecting with the patient's pain, we don't identify with the pain. Therefore, we don't suffer from the caregiver burden. The empathic listening process, through which we understand the patient's pain and suffering, intrapsychic conflicts, is indeed a phenomenological process. Phenomenological studies have been criticized in the past to have metaphysical components which is argued as cannot be evidence-based. But with this study, I have disproved it. With this study, I am proving that clinical assessment process itself can be evidence-based. Till now, the assessment process was never evidence-based. Number 2, with the 3 advantages that I just listed above, empathic listening process is most important process for clinical assessments. Finally, I am arguing that the clinical chaplaincy training curriculum on the empathic listening process which is an accredited program, can be easily incorporated into the curriculum of clinical, medical, or psychiatric residency training programs as well. And it's very important. These are my arguments, and this is my presentation. Thanks for listening to my presentation. If you liked my research, And if you want me to win this research competition, please register yourself at the American Medical Association's Virtual Research Challenge and go and vote and score my research poster. Thanks so much. Bye-bye.